All right. Apparently, my iPad had something against my talking about primates and stress, so I was cut off there. So if you're wondering why the reason for the abrupt ceasing of recording there, I have no idea. But in any case, I am back, and we were talking about the effect of socioeconomic status or social status. It does tend to play a role in stress. People who are more social, more socially adept, tend to have um, better ability to deal with stressors. People who are low social status tend to have higher cortisol levels and just more anxiety in general. Not very surprising when you think about it. The people without a lot of social interaction, social connectedness, would feel more anxiety related to this sort of thing. So it's almost predictable. I don't know what I make of it. It is. I don't think it's more of a correlational thing, I think. But I don't know. It's interesting. So, um, so we're talking about anxiety, the relationship to stress. We look at sort of um, several different factors. Um, the vulnerability in mental illnesses contribute to medical issues, physical illness. Generally, the factors here that play a role are stress and also perceived uncontrollability. Um, how little control we feel we have over a particular situation. And if you think about it, that also makes sense. I am sitting in a new place this week. I cannot get comfortable. The lighting in my house is terrible. This isn't any better, but you'll see me moving around a lot because I'm terribly uncomfortable. So, how uncontrollable we see something determines how stressed out we get by it. Something that feels completely out of your control is going to feel more stressful to you. That makes sense, right? Like, if we were in class, I would say write, and you would respond, and we would have conversation. But now we just have pretend internet conversation. But the more control we have over a situation, less impact it has on us, even if it's very stressful. We are all freaked out and stressed out by COVID and by the fact that we're all still to some extent under some quarantine or limitations in our abilities. Who the heck knows if schools are going to open? Who knows what's going to happen with you guys coming a semester from now? Who knows if I'll teach next semester? Actually, I think I won't teach next semester. I think I've already been told that. But it's just like everything's so unpredictable right now, and it makes complete sense that it creates all of the stress in our lives. Also, I just mentioned the lack of social support can cause an increase in anxiety, and also just some people are more prone to have a negative affect. They see things; they're more gloomy. They're more Eeyore. Winnie the Pooh reference for some of you who may like Winnie the Pooh. I enjoy Winnie the Pooh. You'll also notice I'm wearing a Dallas Cowboys shirt. I am a Dallas Cowboys fan. They just lost a terribly heartbreaking game, but that's that happens. Been a fan long enough that they lose all the time. So, in any case, I apparently should be on ADHD medicine today, y'all. And also just so we have the perceived uncontrollability impacting how vulnerable we are to stress. Lack of social support, also just our natural tendency to see things through a particular point of view. If you're a rosy, sunny, positive, optimistic person, you're probably not going to be stressed out as much as people who are gloomy all the time. They're always stressed. Also, how we interpret physiological responses is going to be important here. A big part of dealing with anxiety, panic attacks, is teaching people to accurately read their own body. So when you start having hyperventilations and you start having an increase in your blood pressure, you're sweating, you feel a little more nervous, knowing that that is the start of anxiety and not the start of a heart attack, being able to accurately identify your body's symptoms is very important when you're dealing with stress and anxiety, and knowing what symptoms mean to you. And so our interpretation of some of those symptoms can cause us a lot of anxiety and stress. If you feel like every time your pulse is rapid and your heart is beating faster that you might be dying, that's going to create a lot of stress in your body, a lot of anxiety. So I think that makes sense. And there's this graphic here in your textbook, and it's in the PowerPoint slides that I'll include too. But it shows like a man, and it says something to the effect of the depression is on the side of less control, and excitement is on the side of more control. So just an illustration of how much better we feel about the same situation depending on how much control we have over it. Just kind of skip through this. And there's several slides here about stress and your immune response, but I just want to focus on sort of one of those to quickly sum it up. There's the drawing. It says part 3. It's like the third immune system slide. But you look at the psychological characteristic or state. So in this case, we've been talking about anxiety and sort of panic, so we'll continue to use that. So you have this panic, you have this anxiety, and then that will cause this hormonal response, the release of cortisol, the adrenal response, release of adrenaline into your body, the activation of the central nervous system. So you've activated the fight or flight system, and then the behavioral changes. You're fearful, you're avoidant, you behave in a certain way. All of that creates a change in our immune system, which makes us more likely to develop a disease. And that's often when we're talking about this class, it's taken us a long time to get there, but our immune response is really what we're looking at. Stress decreases our body's natural immune response, making us more likely to get illness. That's why everybody gets sick at finals time. It's legitimate, and I think it's probably happened to you all too. When you get in situations where you're more stressed, we feel crappy. We have headaches and we have nausea. We don't feel so well. We start getting colds, and and it's all because stress has this inherent ability to decrease our immune system, and it wears us down over time, making us more likely to get things that we would have avoided normally. So you'll get a cold when you never get sick. You will get kind of something that you could have fought through pretty easily will just kind of wear your body down to the point that it has a significant impact on you. And it's all because of the reduction in your immune response. And that happens when all of those stressors activate the sympathetic nervous system. They start breaking down or increasing the cortisol in your body and breaking down those brain cells in the limbic system that result in our inability to process stress. And over time, this can be deadly. It can create a lot of problems. So let's see, let's skip through some of that. We mentioned AIDS, so we'll go ahead and talk about that. This is still a very common disorder. Your textbook has some older data, 34.2 million cases in 2012. So it's still very common. We've seen a resurgence in recent years as we've had an increase in the amount of IV drug use. For a while, we were seeing a reduction in HIV and AIDS cases, but we're starting to get more and more of these again. And so the median time from infection, first contracting HIV to full-blown AIDS is 7 to 10 years, roughly. And stress plays a big role. First of all, the stress of learning that you have the disease, this deadly disease that we still don't have a cure for, and it's been around since that we know. I mean, we were diagnosing it in the early 80s, but this. So for us, this is a disorder that's been around since the 80s. We still don't have a diagnosis or a good cure for it. We have a lot of treatments, but not a lot of cures, effective anyhow. So the stress of learning you have this disorder can be very impactful, can cause a lot of depression, can cause significant amounts of anxiety, and can further exacerbate the health concerns. So you have this disorder that breaks down your immune system. It's an autoimmune disorder. So naturally reduces your immune response. Stress also decreases your immune response. So stress can be deadly for someone with HIV or AIDS. So it works both ways. So a lot of what we have done in terms of treatment for AIDS is stress reduction. In addition to the medications that help manage your viral loads and manage some of the symptoms, we're also looking at ways to reduce stress, support groups, just mental health counseling to look at dealing with the anxiety, coping with the stress, and as a result, improving your immune system functioning. Because a disease that already is attacking your immune system, you need every benefit that you can. So teaching how to reduce some of the stress as you're going through, and not kind of overloading your immune system any more than you need to. And then, cancer we talked about earlier with my sort of personal example. One of the things here you're looking at, not only, again, the psychological impact of learning you have a disease that could be deadly. We have a lot of treatments for cancer now, but, that's still that's a 4-letter word, right? Like cancer is a scary word for anyone. The C word. Sometimes we don't even say it. But we all know about it, and we all know that it can be deadly, and we're generally scared of it. And part of this is the lack of control. It's a disorder that I don't know the course. Some people bounce back from it. It depends on the type. It depends on how severe it is. It depends on how long I've had it. It depends on, what shape I'm in physically. But I don't have a lot of control, or I perceive that I don't have a lot of control over the disease. And so oftentimes we don't have the ability to cope with that. So again, it's a disease that decreases our immune functioning, and you need a strong immune system to be able to fight the disease, to be able to successfully treat the disease. So as a result, we really have to control stress in people that are dealing with cancer. It's overwhelming, and it often sort of changes your life. You get treatments that are kind of intense and hardcore and can make you sick, and you have to change your normal everyday schedule. You might have to go to treatment all day long, a couple days a week or a couple days a month. It makes you feel lousy. It just changes your world. And so again, that lack of control can, in addition to just the physical symptoms that come along with that, can cause like this breakdown in your immune system, increase in stress, higher rates of depression, things like that. So it's only natural. So what you're looking for in terms of psychological treatments is helping people deal with the emotions of learning they have cancer, going through the sort of the grief of having cancer. Even for people who are going to live, there is this grief that's associated with a disease like that, helping people process that in their mind. What does this mean? How is this going to impact me? How is it going to impact my family? There's a lot to unbox there whenever you're talking about a diagnosis like AIDS or cancer. And we have to start looking at some of those factors. And, in terms of treatment, working through some of the depression, we're often using antidepressants. We're using medications for anxiety, in addition to all of the other medications people are going to be on. And how does that impact their life? How does that change what their everyday life is going to be like? We're about to get into October, which is Breast Cancer Awareness Month. And so, I think it's important to think about it in terms of some of the overall impact. promotions that increase like the social support for people and that make women and everyone more aware of issues like body image that come along with breast cancer or low self-esteem that come along with that. Again, the lack of feeling in control, lack of optimism, and just you know the hard nature of dealing with a disorder like breast cancer. Um, there's a lot of psychological component to that. People, particularly when your treatment is mastectomies and dealing with the psychological impact in a world that still is very focused on traditional standards of beauty, and how do you fit into that, and how do you cope with that, how do you deal with that now after you've dealt with breast cancer, after you lost breast or maybe both, and how does that impact your self-esteem and body image even going through, now that you've, assuming you've lived through the disorder, how does that impact the rest of your life? What does that mean for you mentally? And I think a lot of people struggle with the next phase after getting through the treatment phase. After you get through the part of I'm going to live, figuring out what the rest of your life is going to be like can be kind of difficult. We do have the benefit of a lot of education and information out in that particular area, but truthfully, there can never be enough. Also talked about cardiovascular stuff, heart and blood pressure issues. High blood pressure has the increased risk for stroke and heart disease and kidney disease. It breaks down your blood vessels, and stress is highly implicated in that. Stress in its very essence causes hypertension, causes your blood pressure to go up. The more stressed out I am, the higher my blood pressure is. And you probably know that already. We just sort of intuitively know that. But it is a huge risk factor for heart disease, high blood pressure, the ability to handle stress, cope with stress. People who are more anxious tend to have more high blood pressure, tend to have more heart disease, tend to have worse outcomes as it relates to those two. High blood pressure, hypertension affects over 27% of all adults, 29% for everyone over 18 years old. African Americans are most at risk, and things like anger and hostility play a role. People who are calm, cool, collected are less likely to have cardiovascular problems, hypertension particularly, than people who are more angry and hostile and just irritable and handle stress more poorly. So, you extend that on down the line, and things like coronary heart disease also are impacted here. And, some of the risks for coronary heart disease are stress, anxiety, anger, poor coping skills with those things. So you have all these anger and anxiety, and you don't know how to deal with it. You don't deal with it well. Maybe you drink alcohol or do drugs to kind of help cope with your anxiety. And that certainly can also negatively impact our heart functioning. Smoking, diet, poor exercise, all are risk factors, and also lack of social support. So again, what we talked about at the beginning, the life factors, like smoking and drinking and not eating well and not exercising. You throw in the lack of a good social network, poor coping skills, and it's a powder keg. It's the recipe for disaster. Type A people are more aggressive, assertive, tend to have higher risk of cardiovascular disease than people who are more type B personality. So, let's go through, let's talk, chronic pain is another medical disease that has a lot of behavioral components, mental health components. And you can think about what we're talking about here is people that are constantly in pain. It's not like an acute injury where I break my ankle in 6 weeks or so, my ankle heals. I don't have pain anymore. This is pain that goes on all the time. It's not easy to predict. I don't know when it's going to happen, but it pops up all the time. Back pain, things like that are often the most common. And it is subjective. There's no way to test for pain. And so it's hard to tell. We can't tell how much pain someone's in. We can ask them, are you in pain? Or I can have ranking scales saying on a scale of 1 to 10 how much pain you are, but I can never really understand the pain that somebody else is going through. And so it makes it very difficult for us to be empathetic to other people. Also, we go back to the feeling like you don't have control over the situation. For chronic pain, I don't know why I'm in pain. I don't know what's causing it. I don't know how to stop it. I don't know when it's going to come on. So it can create this sense of uncontrollability and anxiety and stress that are related to that. And you throw in again some of the common things that we're talking about today, where you have not a lot of social support. People tend to have bad coping skills, poor coping skills for dealing with stress and anxiety. And a lot of negative emotions are particularly related to the pain, and that makes this situation worse. It can create depression as a result of dealing with this pain day in and day out. It wears you down. It takes a physical toll on the body over a long time, and it also takes a physical toll. It takes a toll on the emotional health and well-being. People that are constantly dealing with pain have a really hard time struggling with depression, things like that. Chronic fatigue is another that is very similar to what we're talking about here. And chronic fatigue often, we don't really know causes, but we can speculate and talk about things like being more prone to being high achievers. So people who put higher expectations on themselves are more demanding of themselves, or may have family that are more demanding. Faster paced lifestyles, poor coping skills with stress, inability to manage stress, and people who are constantly feeling like they need to achieve. And our society very much sets us up for that. So it's not, it's pretty natural that we would see increases in things like chronic fatigue. And also, again, your physiological or your psychological misinterpretation of what is going on. We're constantly tired, worn down, and we interpret that as something catastrophic. I'm gonna die. Something really is wrong with me, and I'm never gonna get better. So it creates its own system of depression and anxiety related to the disorder, because we tend to make things worse in our head. Medications don't really work with things like chronic fatigue syndrome. What we have is cognitive behavioral techniques to be able to approach some of those cognitive distortions, the catastrophic thinking, and try to reshape how people think and feel, and also give an accurate interpretation of some of the physiological responses. What does it really mean? Can I see symptoms of anxiety before they come on and start to work to reduce some of those? And some of the treatments that we use are things like muscle relaxation. Some of the same stuff that we talked about with treating depression and anxiety: progressive muscle relaxation, deep breathing, meditation is very effective in dealing with some of these things, particularly reducing stress related to chronic pain. Also biofeedback. This techniques that teach people to control their own bodily responses. Use that a lot with chronic headaches, hypertension. I used to have these little biofeedback dots. They're just like a tiny little dot, and you put it on your wrist, and it would turn colors based on, it's like a mood ring, if you're familiar with that. It would turn colors based on through your pulse. And so if it were, I don't remember the colors, but if it were red, that was bad. Your pulse was too high. You were anxious. So it gave you a tool to be able to realize, to interpret your bodily signals. So I could interpret my pulse being too high. I could identify that. And as a result, I could try to short cycle that to calm my pulse down. And if it got to green or blue, that meant I was able to control my pulse, and my pulse was normal. And it's pretty cool, our ability, once we recognize what our body feels like when we're getting stressed out, that we can intervene if we have some basic tools. Things like deep breathing are not hard to learn. Things like meditation are not terribly hard for a lot of people to learn. Anybody can learn muscle relaxation, so it's not hard to learn some basic skills to help us control some of this. But biofeedback helps you figure out, and it helps give you an ability to interpret some of those body signals accurately. And so it's very effective for things like that. And if you're interested, you can get the biofeedback dots. Just look on Amazon for biofeedback dots, and I'll put a link on somewhere with this whole thing when I upload it, so you can look at it. But I had them for years and used them quite often, and found them very useful. In other treatments, stress reduction and pain management programs are very effective. Group therapy, particularly, support groups helping people deal with the stress and anxiety of their illness, helping people deal with pain, learning other ways to deal with pain rather than medications even. Individual sessions or group, both are effective. Of course, medications are used. We use some medications to treat, benzodiazepines or antidepressants to treat some of the anxiety and depressive type symptoms, but also just learning the sort of cognitive ways to help you cope with some of the stressors that are going on. And changing your lifestyle practices, engaging in healthy behaviors, learning to, or developing good habits related to exercise, good habits related to eating. If you're struggling with anxiety, cutting out things like caffeine or cutting out alcohol or cigarettes can go a long way. Those types of behavioral interventions, health interventions, can go a long way to helping us cope with some of the stressors related to our health. Diet, health, wellness, all of that sort of stuff. And so I think I'm going to quit there because I've already had the video cut off on me once. So this is going to be in two weird parts that don't really go together. But if you have any questions or anything, I'll put, I think for our assignment this week, I'll just do something on the discussion board. So I'll post that in the next couple of days. But if you have any questions or anything like that, please feel free to email me. Have a good week. Thank you.